dancing around the room, singing out of tune, laughing until your belly hurts, or learning to play the spoons. These are all things that I've done with people with dementia, and it's shown me that you really can live well with dementia. And for us, it's small things that we can do that can make all of the difference, and that's why I'm passionate about the work that I do. He was brilliant. He was like this on his leg and all sorts of stuff. My name is Inga and I'm a consultant clinical psychologist. This World Alzheimer's Day, I'd like to speak to you about dementia, about how you can live well with dementia and about how we can create dementia-friendly communities. Often in popular culture, we're given the impression that receiving a diagnosis of dementia is the end of the world. But people with dementia do have value and do give back. While there are people who are dependent on others, there are also people living with dementia who are still going to work, who are campaigners, who are academics and researchers. Dementia is an umbrella term that's used to describe hundreds of diseases that affect the brain. These diseases are progressive in nature and they are not a normal part of ageing. There are 850,000 people living with dementia in the UK, but 42,000 of those people are actually under the age of 65. A big misconception is that dementia is just about losing your memory, and lots of people do have difficulties with their memory, but there are lots of other symptoms of dementia as well. For example, people might have altered perception in how they see things and how they hear things. A big challenge for people living with dementia is actually how dementia-friendly their communities are and how the world is around them and how the world is adapting to them. So what can we do in our communities to make them more dementia-friendly? One, be patient. It might be as simple as if you're in the shop and the person in front of you is hesitating or taking a bit of time whilst they're trying to work out what they need to do, to actually just be patient and to give that person that time, even if you're in a hurry and even if that might be frustrating. Two, be mindful about the ways that you might be able to offer support. You see somebody who is looking worried and confused and you might approach them, or you might go to the shopkeeper to approach them and to ask them if they're okay and if they need any support. And three, be respectful of the person with dementia and the people around them, ensuring that they can maintain their dignity. It might be that somebody with dementia is actually getting really distressed whilst they're out in the community and the person caring for them is trying to support them. And so not kind of pointing and watching and tutting and all the kind of responses that might be quite natural, but actually being mindful of that and that those people are really trying to do their best in a very difficult situation. Language is important and we should not be using terminology such as suffering or dementia sufferer. We should be talking about people living with dementia, because to assume that it's negative is actually stigmatising and can be isolating. If you are supporting somebody living with dementia, then it can be quite isolating, particularly if you don't feel that your community is dementia friendly. The good news is that there are many things that we can do in order to support somebody to live well with their dementia. So one of the ways that you can help as a family member or a carer of somebody with dementia is routine. So thinking about what their routine might have been before they were living with dementia and using that as a clue. But it might be that you need to flex that routine on a given day depending on how that person is doing. But when you're thinking about communicating with that person, you may well need to really slow it down. So giving the person with dementia time to understand what it is that you're communicating to them. And you might be using other communication methods as well. So it might be hand gestures, it might be taking somebody into the shower room, which would be a prompt for them, or it might be showing them a flannel and their usual shower gel, which might help them to understand what you're asking them to do. One of the consequences of dementia is that somebody might start to lose their sense of identity. If you sense that somebody is losing their identity, then a gift that we can give is to hold that identity for them. So using something like a life story book has a record of who that person is, and it might be something that can then be shown to a new carer that's coming in to support the person with dementia, so they're able to see the person behind the dementia. Another way that you can help somebody with dementia is thinking about meaningful activity. So if you have somebody who always likes to do jigsaws, then doing a jigsaw with them may be a meaningful activity. It might be that you need to adapt that activity for them. So it might be having a jigsaw with less pieces in it. It might be, depending on how far their dementia has progressed, that actually putting a jigsaw together might be difficult for them. but they might quite like to pick out all the blue pieces out of the jigsaw box. It might be that they like to put their hands into the jigsaw box and the sound and the feeling of moving all the pieces around is meaningful for them. Or it might be that actually opening up the jigsaw box and that smell that you get is really meaningful for that person and is really powerful. It might bring back memories, it might feel familiar, it might bring lots of lovely feelings. So whatever activity that you're supporting the person with, it needs to be meaningful for them. It's not about completing a jigsaw, it's about the actual experience of having the jigsaw there. I hope you found what I've talked about today informative. And remember, we all have our part to play in making our communities more dementia friendly.